All right, let's pull back the curtain on one of the most common medical moments out there. What really happens after you get a knock to the head? You might think it's a simple question, but the way a doctor figures out the answer is actually a fascinating, super systematic process. We've all been there, right? You trip on the sidewalk, you stand up too fast under a cabinet, and for that split second, you have that little jolt of worry. Is this just a simple bump that's going to need an ice pack, or is it something I should actually be concerned about? So, first things first, let's be clear on what we mean by head trauma. Medically, it's a pretty broad term. It's not just about getting hit directly on the head. It could be an indirect force, like the jolt you get in a minor car accident. And what's interesting is that the official guidelines don't include things like a simple cut on your cheek or a scraped chin. We're talking about forces that could affect the brain. Okay, so when you go to the doctor for a head injury, they are not just winging it. Their number one goal is to figure out the risk of something serious happening inside your skull, what they call an intracranial complication. And to do that, they follow a really structured playbook. For this explainer, we're diving into the updated 2025 guidelines from the Dutch College of General Practitioners. This is where the real detective work kicks in. It's all about how doctors take that initial moment of uncertainty and turn it into a crystal clear plan. It's a methodical process of sorting all the little clues, the symptoms, and the facts into very specific categories. And it all boils down to these three buckets. Every piece of information, from how the injury happened to how you're feeling right now, gets sorted into one of three levels. You've got low risk, which, good news, is the most common. Then there's elevated risk, which means we need to pay closer attention. And finally, high risk, which is a straight-up medical emergency. Let's start with the most serious one right away. High risk. We're talking about the urgent red flags. If any of these symptoms are present, it doesn't matter if the patient is a toddler or a grandparent, it's an emergency. And this list is absolutely critical. Lowered consciousness just means someone is really drowsy, confused, or hard to wake up. A seizure right after the injury, that's a huge warning sign. High energy trauma is exactly what it sounds like: a serious car crash, a fall from a ladder, something major. And focal neurological problems are clues that one specific part of the brain is in trouble. Think sudden slurred speech or weakness down one side of the body. If even one of these is happening, it's time for immediate emergency care. So, for those situations that aren't quite emergencies, doctors turn to a checklist like this one for adults. See how it's split into two columns? Things like throwing up just once, being over 65, or blacking out for a second. Those are considered light risk factors. But things get bumped up to moderate if the vomiting won't stop, or if someone's on serious prescription blood thinners, anticoagulants, because that can increase the risk of a bleed. And check this out. This is a perfect example of how medicine is always evolving. The 2025 update actually raised the age for that light risk factor. It used to be age 60, but new data shows it's really 65 where the risk starts to change. It's a small tweak, but it's based on a much better understanding of risk. And here's another key change. The guidelines are getting way more specific about blood thinners. They've now officially classified certain drugs that stop platelets from clotting, like clopidogrel, as a light risk factor. And they're careful to point out this does not include the common daily low-dose aspirin. That level of detail is just so important for making the right call. Now, for kids, the checklist looks similar, but there are some really important differences. For a child, losing consciousness for more than just 5 seconds is a light risk factor. And look at that moderate risk column, clearly altered behavior. This is a big one. A little kid can't always tell you what's wrong, so a major change, like if they're suddenly impossible to console, super sleepy, or just not acting like themselves, that's a huge clue for the doctors. Okay, so the doctor has gone through the whole checklist. They've added up the risk factors. What does it all mean for you? Well, this is where that checklist turns into a real, concrete plan. It flows into this super clear decision pathway. High risk, that's having any of those urgent red flags we talked about, means an immediate trip to the emergency room. No question. Elevated risk, which is either one moderate factor or 3 or more light ones all added up, that means it's time for a referral or a consultation with a specialist. And finally, low risk, with fewer than 3 light factors, means you get some advice and can head home to recover. So let's focus on that low-risk group for a minute, because honestly, this is where the vast majority of people with a minor head injury end up. So if you're in this category, what do you do next? The very first piece of advice is just simple reassurance. This quote from the medical guideline itself says it all. The outcome is usually good. And that's not just some nice platitude. It's a medical fact based on tons of data, and hearing it can actually help reduce anxiety, which is a big part of recovery.
So, you've been sent home. What does a safe recovery actually look like? Well, the guidelines give some really clear, evidence based advice for how to handle those first couple of crucial days.
Now, this is a big one, a huge shift in thinking that might surprise you. A lot of us grew up hearing the take waking advice, but you have to wake someone with a concussion every hour through the night. Well, the 2025 guidelines officially say don't do that. Why? Because it turns out there's no good evidence it helps catch problems any sooner, and all it really does is mess up sleep, which is one of the most important things for healing your brain.
So if waking someone up is out, what's in? Well, here's the modern playbook. Gentle activity is actually a good thing. Total bed rest can make recovery take longer. Plan on easing back into work or school after 2 or 3 days. Definitely avoid alcohol since it can hide symptoms that are getting worse. And this is interesting. Some evidence suggests that limiting screen time can actually shorten recovery by a few days. And for any pain, your standard painkillers like paracetamol or an NSAID are totally fine.
But, recovery isn't always a perfect straight line. Even if you've been told you're low risk, it is so important to know which symptoms are a sign that you need to pick up the phone and call the doctor again.
These are the key warning signs to watch for at home. If the person starts getting really drowsy or hard to wake up, or their behavior suddenly changes, that's a call. If a headache gets way, way worse or feels totally different than any headache you've ever had, that's another. Vomiting more than once, or any kind of new confusion, those are your signals to get medical advice, again, right away. So there you have it, a peek inside the doctor's systematic approach to a knock on the head. Now, the point of understanding all this isn't so you can diagnose yourself at home. It's about being empowered. It's about knowing which signs are probably nothing to worry about and which ones are serious. But the biggest takeaway of all is this. When you're in doubt, what's the most important thing you can do? It's always making that call to a professional. That's always the right decision.